say the words social media, we tend to think about the internet, but that's just that's what social media is known as right now. But we go back historically and look at things like the telegraph and the Pony Express. Those are all social media. Hieroglyphics in the tombs in Egypt and cave wall prints were all social media. And the telephone, when it first came along, all the business people got together and said, wow, the telephone, we can get to each household and give them a call and find out what they want and sell them. And so it's just another example of the internet social media. And the internet social media is different from like the telephone because it's going to change a lot faster. So we have Facebook today. 10 years from now, we can't imagine what we're going to have. Our view is that it's really word of mouth as a social medium. And that's what we're really looking at. What are people saying about our hospitals? What are they saying about our doctors? And we find out that not a lot of people are saying a whole lot about the hospital or the doctors. You know, they go to the doctor and they find out, oh, it was a great treatment. I really like the doctor. But when they leave the doctor's office, they don't tell anybody about it. And so we find out that only about 30% of the people, once they leave a hospital, are going to get out and tell somebody about that hospital. Now they're going to tell good things and bad things. And what I tell hospitals is that if you want to be sure to have good word of mouth, you have to have good patient care. Because word of mouth doesn't come from the marketing department. It comes from how people were treated, whether or not they lived or died when they're in the hospital, and whether or not they got their problem solved. And for many hospitals, the death rates are exceedingly high. So if you ask, before you go to the hospital, ask them, what is your mortality rate in your hospital for this particular surgery? And then compare that to other hospitals. And that's how word of mouth is spread, because people know what experience they have had and they tell other people about it. One of the critical areas in a hospital is the emergency department. And we know that most people, when they go to the emergency department, they have a complaint. They had to wait too long. And so what we've done, and a lot of hospitals have done this, is we have somebody in the hospital, in the waiting room of the emergency department. So when somebody comes in, somebody talks to them. Not necessarily a nurse, can be a volunteer. Now, if they need to have triage and they have something really like a pain in their arm, then they get immediate triage. But for the others, what we do is we tell them how long we think the wait's going to be. And we come back to them, if we say it's going to be 30 minutes, and we come back to them in 30 minutes and find out that's not enough, then we say, oh, you know, we're really running behind it back there. It's going to be another 15 minutes. So that the patient is informed rather than the patient just sitting there. Sometimes they sit there for 7 hours. And if they do that and nobody's talking to them, telling them what's going on, they're going to carry bad word of mouth outside of that hospital. But if somebody's in touch with them the whole time, and we have one hospital, Brigham and Women's Hospital up in Boston, and they tell them, they say, look, it's going to be quite a bit of wait. Can we give you a pass to go to the cafeteria and get something to eat? And if the people are ambulatory, they say, sure, that'd be great. And when they leave that hospital, they have nothing but good word of mouth. What we do is create testimonials, video testimonials, and that's what I'll be talking about tomorrow afternoon with Baylor Healthcare System. And so they take patients who have had a good experience, and they put them in front of a camera like this and say, okay, talk. There's no script, just like there's no script here. There's no script, and they just talk about their experience, what happened, why they were satisfied, what kind of things could have been improved. And that is put on YouTube and on television and available within the hospital for the staff to view during the day. One of the things we're doing is through mail surveys, because we find those are very effective. Because people don't get much mail, and when they get a piece of mail, they take care of it. But we're asking people, by survey, what hospitals have you recommended in the last 6 months to anybody, if any? Which hospitals were they? And what is it you told other people about that hospital? And this information before this just really hasn't been available. All we've done is ask people what hospitals come to mind in surveys. So we're going a little bit deeper than that. Ask people also, have you ever told somebody not to go to a particular hospital? And what hospital was that? And why did you tell them not to go there? And we do the same thing for physicians. Why did you go to that physician? Who was the physician? And why did you tell them to go to that physician or not to go to that physician? And then we take this information to the hospitals, and they can look and see what people are saying about them and change the way they're operating to get good, positive word of mouth. One of the things they talked about was how long it took for the patient when they went to admitting, and also how uninformed the admitting clerks seemed to be. And when they asked the admitting clerks a question, they said, well, you know, that's not my department, you'll have to talk to somebody else. And so we started educating the admitting clerks on all sorts of facets about the hospital, you know, and that helped improve word of mouth outside of the hospital. And that came from a survey of the people in the community, finding out that the admitting clerks, it's sort of like the tellers in the bank. They're the lowest paid, and they're the ones who are the first people to meet the customer.